Okay.
Let me just ask if anybody. ¿Alguien aquí ocupa traducción en español? ¿Alguien más? No.
Okay, perfect. Great. Thank you all so much for joining our workshop. We have a really exciting conversation today. We're going to be talking about movement building and how we can use organizing as a tool to win on healthcare reform campaigns, although I think the lessons here can be really applied to a lot of different types of work. My name is Samantha Schwimmer. My pronouns are she, her, and I'm the Southern California Regional Organizer here at CPEHN. And I am really excited to be joined today by some of my colleagues, so I'll pass it off to them to introduce themselves.
Hi, everyone. I'm Maky Peters with SEIU-UHW, the Healthcare Workers Union. I'm the Southern California lead and political organizer for UHW.
Hi, everyone. My name is Sejal Patel. I am with an organization called Rising Communities. We have to speak slow, so I'm going to try and practice because, we want the interpretation to be well done. So Rising Communities, I'm the executive director of Rising Communities Foundation, and it's just so nice to be in a room of organizers. So thank you for being here. It's lovely.
Great. And so, yeah, thank you all so much for joining us. I'm just going to kind of frame what we'll be talking about today and tell you a little bit about how you all are going to get to participate. So, I think something we really talked about this morning, and I think something I've talked to many of you about in other spaces, is how challenging 2025 has been for all of us. I think we've faced an unprecedented amount of threats to our community in this year. It feels like a lifetime. We've seen some of the worst attacks on healthcare in our country's history. We've seen devastating ICE raids rip apart our communities. Even at our own state government, we've seen attacks on healthcare for our immigrant communities. And so I think in a moment where loss feels inevitable, it can be daunting to figure out what steps we need to take. And in those moments where I feel really lost, I kind of turn to this phrase that's used very frequently in union or labor spaces, which is don't mourn, organize. And I think, how I really take that phrase is, it's easy to kind of sit in the weight of all of the attacks. And it's a lot harder to sit in that weight and then you can't hear.
No work.
It doesn't work.
No.
Oh, okay.
Just wanted the.
Okay. Thank you for letting us know. We'll make sure to get that fixed. Okay.
Yeah. Normalizado.
Sí.
You
You can hear?
Can
You're
you?
good?
Oh, no.
Okay.
Okay. Perfect. Thank you so much. No, thank you. This is a great example in this moment. When we're organizing, we have to think about how are we making sure everybody's ready to show up in the space? And so taking the time to make sure that we're all able to be here is a really important part of organizing. So I'm really grateful to our interpreters who are making sure that folks are able to be here and participate. I also want to name another, we changed a panelist today. And that's another part of organizing work. Change and unpredictability is part of the world that we're living in. And so the ability to be adaptable in the moment and change plans last minute is a key part of the work as we're moving forward. So I'm really excited to kind of delve into these ideas about how we can come together in this moment to face impossible challenges. And we're going to be joined, by all of you too. And I want this to be a really interactive session. There will be opportunities for you to answer questions as well, for us to learn from you. And so before we get into all of that, I want to just practice audience participation. And so I'm just by a show of hands, I just want to get a sense of where y'all are from. So, if you're coming to us from Imperial, can you raise a hand?
Okay.
Great. If you're coming to us from San Diego or Los Angeles, can you raise a hand? Orange County. No one from Orange County.
No organizers from Orange County.
I don't like Orange County. For the pan. No, I'm just kidding. I love you all. Inland Empire. Okay. Bay Area. Bay Area. Central Coast. Amazing. Central Valley. Okay. They're too busy at the beach, I guess. No, not the beach. I was getting confused with the They're too busy in Fresno. I don't the party then. What about Northern California? Further up, further past the bay, Sacramento, Butte County. Or yeah, okay, great. Did I miss anyone? Probably. But I'm so glad that you all are here. And then just again, how many of you all are here with a nonprofit organization? Okay. Nonprofits represent. How many of you are here with labor? Okay. What about academics or public health? Okay. Great. So we have a lot of different knowledge in this room and we're going to use that today and I'm really excited. So there will be opportunities for you all to answer questions. When those opportunities come, I'll be speaking directly to the audience. I'll invite you all to raise your hand. I'll call on you. I just ask that when you're called on, if you could stand up and introduce yourself and your organization, and then make sure that you're speaking slowly and clearly so that the interpreter is able to hear you. And yeah, with that, I'm really excited to do our first audience question. I'll invite 2 to 3 people to share an answer to this question, which is, what does organizing mean to you? Take a second to chew on that. Oh, you're ready. No second needed. No, please.
Together.
Can you stand up?
Stand
Yeah,
up.
thank you so
Name,
much.
work.
Sorry.
Be brave today. Perfect. Can you and then share your name and what work you're with?
Hello, everyone. My name is Juan Carlos Diaz. I'm a community advocate with the Mixteco Indígena Community Organizing Project. And
No, you're good. And then the question was, what does organizing mean to you?
just I'll just answer short and getting together.
That's a great answer. Thank you. Yeah, clap it up. I love it. Anybody else want to share? Yeah, please.
Hello, everybody. My name is Malik Glasgow. I'm with Access to Thrive from Imperial County. And organizing to me, I think means, like you said, coming together, but I understand and say like behind solutions, coming together behind not necessarily a problem, but a way to solve that problem. So that's what.
Thank you. I love that. Yeah, clap. Yes. It is not easy to stand up in front of a room full of people and share. So I thank you for that vulnerability. I'm now gonna turn to the panel and we're gonna get to know more about them. So first, I will pass it to Sejal. So can you tell us more about you and what brought you to this work?
Hey, so again, my name is Sejal Patel. I say in a room of everybody, I say it's like Sejal, like Rachel or Angel. But so I grew up outside of Detroit in a suburb, and we were an immigrant community that came to, do the American dream. And we lived in a lower middle class suburb of Detroit, 16 Mile, if that means anything to you. And unfortunately, the American dream has its nightmares, right? And so being an immigrant coming to the US in a cold place, it was very isolating, and not only in the community, but also in the home. My parents, they had a huge adjustment, and there was honestly no love in the home. Like, I didn't have anybody that gave me a hug or a kiss or told me that they loved me. And we were house poor, so economically, even though I had a 4-bedroom home with a 2-car garage and my own room, emotionally, it was it was a lot of impoverishment and difficulty. And so, that, and then because there wasn't a lot of like culture and it was very isolated, I read a lot and, read what was in my home, which was like Alex Haley and the Roots and Dickens. And so really understood social inequity in these larger ways. And then I went off to college and it completely opened me up to the severe economic realities, like especially with US imperialism, all over the world. And it was funny because we used to watch the evening news for dinner every single night. And it was just like, why didn't the evening news tell us this? Like what the heck? But that's now we know the media is the media. So so there, especially being in Michigan, because it's a predominantly white population, we have to come together as people of color. That was the only way that you could, strengthen as a community and get things done. And we did. That's where I created a lot of, we created, that's where my activist roots came from. We did many, many things at Michigan when we were there. And 2 of them was exposing a secret society there called Michigama. And it was, privileged, all men, blah, blah, blah. And literally it was housed in the ivory tower. At the top of the ivory tower, secret, nobody knew about it, but there was rumors and we came and just blew it up. And we would do tours up there and they would use Native American culture within. Yeah, it was gross, right? It's so gross. Like they use Native American culture within their full bro thing. And it was so disgusting. So we would do tours and people would see like they had all these Native American artifacts and all this stuff up there. And it was like, I felt so badly for the artifacts itself because they had to see years and decades of just stupidity, literally, right? So that was one of the things that we did. And then we were able to give all those artifacts back to the Native American community. And then but it was a coalition of Black folk, Latinos, Native Americans, Asian Americans. It was just very, very cool. The other thing that we did together was earmark funds for the largest hiring of professors of color to come to Michigan. And it was not only in our ethnic studies department, but across the whole campus. So just things like that was just, wow, we could do this. That was a start to something that there was so many possibilities. And that's what I really want us to focus on is just, there's a lot, it's too much, but we have to continue to focus on the possibilities, and that's with each other, right? That's who we have. So then, I came to LA and have had the privilege of 25 years of working for economic justice, environmental justice, health equity in Los Angeles. I work right now for a organization called Rising Communities, and we came out of the 1992 LA uprisings.
What is the name of the organization?
It's called Rising Communities. Thank you. Health for Angelenos in South LA and South Central Los Angeles. And now we've expanded throughout all of Los Angeles County. I private sector for a bit, 5 years working in natural resource asset management, and it was like making money for the sake of. Although I learned a lot about project management and this and that, I was just very unhappy. So we were spoiled, because there's so much resources in the private industry, but we got, for instance, a plane to go, like we had a private plane to go out to the Central Valley and acquire our water and our land and all this stuff. But it was just not fun at all. And it was very, very difficult and challenging to have to appease, like liberals who don't really get how we're exploiting people who work on the land. And so I'm really glad to be at Rising Communities because our community, we want to support each other, we want to give so much to each other, and it's been a really great journey, and I'm glad to be back with the public sector, like with the people, so, yeah.
Thank you. I feel like we were like watching a Marvel superhero origin story during parts of that. I like had learned so much about you. Thank you for sharing. And I'll pass it over to Maky.
Yeah. I mean, so I think similarly what brought me to this work is my lived experience, right? And it was helpful to hear you talk about it because I wasn't thinking about this in such personal terms, but I grew up first generation child of immigrants, and I had, it was a little bit of a rough time. I grew up in a very fundamentalist religious sect. I experienced a lot of sort of culture shock when we moved and found myself in, not a very diverse community. And then I left home when I was 16. And so I had to fight my way through a system that was stacked against me to somehow make it to getting into college, to even survive up through, those like very young, vulnerable years of being a young woman on her own. And in doing that, I experienced firsthand, actually at one point I was a healthcare worker. I was full-time employed in an ICU, and I had two other jobs too. I was a waitress, I was nannying, right? Like you just got to hustle, you got to do what you can do to survive. And at that time, just a series of emergencies, just unforeseen circumstances took place, and I found myself living in my car, right? And so, flash forward, it took me about 5 years to finish getting through community college, get into school, finish my bachelor's degree. So many challenges that took place over the course of that journey, to have no financial support, no community support, no family to lean on, right? But then upon getting out, I worked for an elected official who was running for state assembly. When I was at school, I met somebody who, she's like, I came from the Obama administration. I came from organizing, like, we're going to do something different in the Bay Area. I worked with her as her field director. For sure wouldn't have gotten that opportunity if I was not at school at Cal Berkeley. Like, that would not have happened. And then from there afterwards, I was like, okay, I got a pretty good inside view of like who's at the table in these spaces. That was a good learning experience. I don't think it's for me. I do think it was a worthwhile education, right? I'm like, okay, we know all Newsom's people. We know all, okay, that's good. But I was like, I think I want to take a turn into labor organizing. And there was an opportunity to work at a healthcare workers union. And I was like, I've been a healthcare worker before. I know exactly how you can be a full-time employed healthcare worker, right? And the job I was doing, and for many healthcare workers, it's a job that you actually have to pay money to get accredited to get that job, right? And then that job still doesn't pay you enough to be able to get by, right? And we're talking about like 2014. So, you can adjust that for today's world, right? And we understand how so many people are struggling as they are. And so in any case, I got that job, became political organizer for Southern California with UHW. And to give you a little bit of background about the organization, so we are a healthcare workers union that is statewide. Our local represents workers primarily at private hospitals, but it's stretching a little bit now. So we've organized Planned Parenthood. We've been working on dialysis centers for a long time. We're now looking also at community clinic systems and organizing those workers. So, but if you think about like the Kaiser strike that happened a couple years ago, that was our workers. It's pretty much everyone other than the physicians and nurses. Everybody who runs a hospital, we actually do represent some nurses, but the easiest way to think about it, right, is your EVS worker who is keeping things sanitized and clean and safe, the people who are working in food and nutrition, the radiology technicians, the ER technicians, the OR technicians, everybody else who is really the backbone, the engine of running a hospital. That's our membership. And so over 120 members. Also, find myself very privileged to be in a place that's like very well resourced. So we're able to like bring bold ideas and really carry them forward. But yeah, so I feel very lucky to be in this position and doing this work. Yes, SEIU, yeah.
He was just saying that.
Oh, you were, oh, okay.
Yeah, I'm still in that union.
Oh, amazing.
great.
Fantastic.
Amazing.
In Imperial.
And then,
Yeah.
Awesome. I was working in Imperial for a bit, like last year and a half, doing some community clinic stuff down there. Yeah. Awesome. But yeah, so, but that, that's kind of what brought me to this work. It's why I stay in this work, and like just every year it's a greater nightmare than the last. And so I don't see myself going anywhere anytime soon. And yeah, I just really appreciate being in this space with you all today.
Yeah, thank you so much
Yeah.
for that. I always get to I love learning about people because I think we all have our own journey to getting to this work. And so I think, it's so important to remember our why and what brought us into the work. So I appreciate you both sharing that. And now I'm gonna turn the question that we just had to the audience over to you, which is, what does organizing mean to you? And we'll start with Maky.
Sure. I mean, I think for me, I'm thinking about this especially a lot now these days. Like, organizing is not just advancing policy goals. It is not just having a win if we got this person elected and now we're shifting. It's good. We should be doing all these things for sure. But I really view organizing as more than just mobilizing, more than just reaching a finish line, right, of some sort of a goal that we've set for ourselves. But really, how are we developing the class consciousness of workers, right? And of our neighbors and of our communities. And so there can be organizing within the labor movement, right, which looks a particular kind of way. But then for me, myself as an organizer, somebody who lives here in LA, who's, I'm an Angelino also, it doesn't just end at what we get paid to do for our work, right? We're very lucky to be able to do that for our work, but also it is about, how are we interacting with our communities? How are we, as we're working with our own members in my case, right? Developing them to understand the issues and to themselves be organizers, because that is really the goal. It is all good and well for me to have gotten to a place where now I understand so much more than I did when I was, in my early 20s and a healthcare worker and doing all that stuff, and had a little bit of a North Star, but I didn't really understand how it worked. But what good is that, if I'm not multiplying that by 1,000 other people, and if they can then become messengers and organizers in their own communities for their own neighbors, their coworkers, their families, right? And I think in this moment, we see so much how that is critical, because we are going to be the ones who are protecting each other. And so to me, that's what organizing is. It's really about movement building. And it's about how are we, an engine for change that doesn't just begin and end with us in the conversation I've had with one person, but for them to really be able to carry that forward, everybody bringing their own strengths to just continue spreading that outward exponentially, right?
And I'll pass it to Sejal.
Yeah.
Yeah.
So in terms of a CBO perspective, and organizing, so I think if I would have been asked this question prior to January 6th, I would have had a very different answer about organizing. And since January 6th, we've had the fires, and that's changed, right? Then we've gone into emergency organizing and helping people who are really impacted by that. And that was across the board, right? Because in South Los Angeles, you've had a lot of people who lost jobs because they were working in those communities. And then we had the Trump administration come into power on the 20th, and then Elon Musk and Doge, and just slashing funds away from all of our services, right? Who knew the government had so much money and was doing so much for our communities? Who knew? And now, and you hear that Doge, some people, those young white boys are just like, oh, actually, the government is really efficient and it does do really good things. And wow, they don't, and they're very regulatory, right? Because we're highly, highly regulated. Private sector, no regulation whatsoever. We are so regulated, and we do good work with that, right? And we're smart because we can handle that complexity and we can make it work. Yes, we can do that. And so now we're in a different boat, right? Because we don't have the money that we used to have. We don't have the opportunities to get those funds that we used to have. Then, we had the ice attacks, and that's in early June. And I think that's where I used to have depression, like in my 20s and 30s, and I hadn't felt that. And then that was just like it, when it was just the ice raids came and it was just like, what? And I was like, wow, depression, my old friend again, welcome, like it was just so hard to see the people that we eat with, that we pray with, that we go to the grocery store with, and they, we just trust with so much of our like own things. Being working people, right? Being attacked and being targeted. It's been so hard. So organizing from our perspective, we've really had to shift because, we've had a lot of wins, as a community, right? At least since the 90s, where we've been able to compensate and incentivize residents who become leaders in their community. So even though they're working their own jobs, that they come back to their community and they want to be leaders in their community, and we've been able to compensate that. That's one of the wins that we've gotten, and it's deserved, right? Like we deserve to be compensated for the work that we're doing to lead, to help support our disinvested communities in better ways. And now that's all coming undone. So now we think really hard, top of mind of like, how are we going to organize now, right? We don't have the incentives, the money that we used to have to do that. And we're going to have to go back to this day and age where, people just had to do it because they wanted to. And which of course now people want to, but they should be deservedly or like compensated for that. So we have to think a lot around like volunteer, getting volunteers and doing it that way. Another way of organizing is that because our services are being defunded, how do we come together to serve our communities now, right? And that's another top of mind question that we have. And one of the campaigns that we put together is called Reimagining Motherhood. And it's a campaign to end infant and maternal mortality in Los Angeles County. So completely zero it out. And it talks about healthy birth. So, both sides of the aisle could probably really get behind it. But we also know that when it comes to infant and maternal mortality, the rates are doubled for the Black community in particular. So we're doing a lot of focus on one of we want to pass policies, and one of the policies that we want to pass is for any Black woman who's pregnant, that they are then coupled with a community health worker and an LCSW that can give them resources and support them. And so again, we're not going to have funding to do this work, but we want to bring together a coalition, and we're working on that to bring together a coalition of doulas and healthcare service providers and advocates to see how we can end this particular issue. And it's great to have a goal, a large goal in mind where people want to come together and organize around that goal. And I think that's been something that's been really useful for us in this day and age that we're in, this era that we're in.
Yeah, something that I noticed both of you talking about, and I'm sure will really resonate with the room since so many of us are in the nonprofit space, is like, how do we pay for our workers to be able to do this work? And, something you were talking about in terms of like class consciousness, I think when we think about the funding cuts that we're experiencing, and I think most of us probably don't get paid enough for the work that we do. And having to juggle multiple jobs, having union members having to juggle multiple jobs, nonprofit staffers having to juggle multiple jobs. In your experience, how do we ensure that our communities are being compensated for their labor, that our communities are able to have access to stable housing, so that they're able to show up for this work? And I'll pass it first to you, Sejal.
So to show up like, without compensation, yeah, like,
Or like, I guess, how do we ensure that folks are able to do the work, and what what do we need to do to make sure that folks are getting paid and that they can afford to live while doing this work?
Yeah, I mean, I think, I don't know. I don't have really the answer to that. I think it's been challenging because, you know, for CBOs in particular, labor is very different, but we have, you know, three forms of funding, right? One is government grants. The other is philanthropy, but philanthropy right now has been organizing their funding to go towards fires and ice attacks. So that's good, you know, all well, but we don't, then we're missing that funding. And then fundraising, just like donor-based fundraising, which again, a lot of donors are also going to issues that really are meaningful to them on their own. So that's what I'm saying is like, we're really thinking hard around, because we might not have compensation, then what should we do? And so we're looking at other models, like the Girl Scouts, for instance, and where they have volunteer managers that they hire to then go out and, you know, organize and get people to come together. And we have spaces like delegate spaces and in South Central that we're bringing together like 2,000 people around that. But we like to incentivize people. We like to spoil people, and for doing what they're doing. And so there is a real shift. And some people think, well, we've been spoiled, and why don't we, you know, we have to go back to what we used to know, and that was probably better then anyways. But it's like, no, like we should be able to get compensated for the work that we're doing. And so that's just something that we're grappling.
Mm.
Sorry, I don't have any.
No, I think that it's I'm interested to grapple in this issue, and I would be curious to hear from the labor perspective how that's showing up for you all.
Yeah, I mean, I think similarly, like, you know, the thinking is that we are going to hit a moment where we're going to see people losing their jobs. And, you know, with this kind of work, especially, it's similar to, it's like so many things in this space these are jobs and opportunities that are only reserved for people who have a certain degree of privilege, that they're able to engage in this kind of work because maybe they have a little bit of a safety net, they have somebody to lean on, that they can participate in this kind of stuff. But also, I think if we look back at moments in history where there has been real community organizing, overwhelmingly, those people were not getting paid to do that work. And so, you know, I think there's like a little bit of like, we have to be aware of the moment we're in. Let's fight in every way that we can of being conscious of the fact that this is the reality, that, and like, who is going to end up losing their jobs first, right? And who is going to get sidelined out of this movement, and who actually might be even more vital in this movement, but because of their respective degree of privilege might find themselves, you know, now less and less able to participate. Having a conscious awareness about that, while also then thinking about, okay, so that, but we have to be responding to this moment. And so how are we supporting people? And I think, you know, for folks in this room who are leaders within their respective organizations, right, advocating for the experience that, you know, your staff or your fellow coworkers or your membership are going through, and bringing that lens to maybe somebody who, you know, maybe it's above our pay grade, the decision, right? But we have to advocate for that and spell out that perspective and that reality for those who do make the decisions, because their participation is going to be critical in this movement. And you know, unfortunately, I think things are going to get worse and not better, right? And so let's be really real about that, and try to bring a spirit of awareness, you know, in as many ways as possible. But I do think, you know, there's not a simple or good answer to that, right? Within labor, it's a little bit different. So long as we have members, those members are paying dues, and, you know, then there's a certain amount of like cash flow. But, you know, we're already forecasting there's going to be a lot of healthcare layoffs. We know that with Medicaid. And we also know employers are going to turn around and say, well, we especially don't have money for raises for healthcare workers. We especially don't have money for greater staffing, or, you know, doing anything to support services, right? And so, you know, it's going to be difficult, I know for sure, in labor as well. But yeah, the mechanisms, of course, are a little bit different. It's not grants so much. Yeah.
Right. Yeah, and I appreciate you both engaging in that question. I think we're in this year where scarcity mentality is starting to really set in, both, you know, because of the economic realities of the moment, but also because of intentional decisions that are happening by our authoritarian leadership. And, you know, I just invite us as we're thinking through the rest of this conversation, how can we combat scarcity within our organizing principles and mindsets? And so, you know, I think that with that in mind, I'm just curious, like everyone has distinct ways of organizing. What are the ways that you organize? And I'll pass it first to Maky.
Sure. I mean, in the labor movement, we have a few different things we would categorize as organizing, right? We have not yet union workers that we're having conversations with them on the ground. We're identifying an organizing committee. We're getting people to sign cards. There's a process. There's a vote. There's an election. There's bargaining. There's all of that is organizing, right? Really classic labor organizing. But then I think too, something that I engage with a lot in my work, especially today, is how are we developing our members to be organizers in their life and in their work, and not just focusing only on what are definitely our priorities, protecting healthcare, fighting for their contracts and their needs, but also for them as individuals, as workers, right? The intersection of all of the things that they're impacted with as workers. So, one of the things we have as a program in our union over the last 6 years I've worked there, we launched something called Leaders to Lawmakers, which organized workers by their assembly district. And we kept in mind, okay, these people live in this assembly district. So when we meet with this assembly member or this senator to lobby for certain legislation, we're going to bring those same workers out to this. If there's other events going on in the community, we're bringing them out to those things so that the legislator and they are building a relationship with each other, and our members are getting to understand the legislative process and who the players are and how things work. In this moment today, we're kind of adding to that, where we're saying, okay, there is so much that happens on a local level, whether it's in LA, rent stabilization ordinance coming up, or sanctuary city policies, or even just learning and getting to understand what is a rapid response network. How do I become somebody who can protect myself, my neighbors, right? And so we've decided to actually kind of broaden that even more and go hyper local, where, okay, we're still going to do the same system of the assembly and the Senate, but also how do we focus on local issues and really arm our members with the understanding of who are the players, how does stuff work at the local level, right? And being a part of these processes of advocating, at the county recently, LA County, we brought a resolution related to immigration issues, and it was like, we're seeing federal agents coming into hospitals. We've been doing Know Your Rights trainings with our workers for well over a year now. But still, when a federal agent shows up at your workplace, it's a whole different chilling effect that takes place, right? And so we went and spoke to the county supervisors and we're like, hey, I know it's not like passing a new law or anything, but what if we pass a resolution that is just uplifting the statute and the rules that many people may not know at this moment, right? That if a federal agent comes in with a warrant that looks like a warrant, but it's not really a real warrant, right? That's not a judicial warrant. And what if we kind of explicitly state that, if they're trying to come behind your desk or behind this door, if that's as personnel only, or that's just an area typically not accessible to the public, they're not allowed to be back there, right? So maybe let's pass a resolution that just kind of elicits like an understanding and a little bit of like a public awareness moment that, yeah, people should, this county ended up passing this in LA County, took a position that we believe in dignity and access and safety for healthcare in this county. And then it kind of like outlines these things. And so now that's something our workers can post up in their break room, even if their employer is telling them bad advice and their official memo says, well, if federal agents come in here, don't hide anybody.